traditional medicine. And when I talk about traditional medicine, I'm talking about hospitals, pharmaceutical companies, anybody in medicine, anybody who makes their money in medicine, who gets reimbursed from insurance companies. They don't make money off of two types of people, healthy people and dead people. They make money off of chronically sick people. It's like a built-in incentive structure, but it would be nice if you had a healthcare system where doctors were incentivized to keep you healthy. They don't have a platform for telling people about all these health hacks that keep people healthy. And I thought it would be fascinating to tell everybody about that and really spotlight the people that are making this happen, staying vital, staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This show comes out every Tuesday. Always looking for the latest, greatest health hacks. We've already covered an enormous amount of information. This is a really exciting show. And so what we ask you to do, if you're listening to this on just the audio, subscribe to it at iTunes. Just hit that subscribe button. And welcome to Health Hacks with Mark L. White. My name is Rusty Humphries. Mark, it's great to see you. We have a fantastic guest here, Dr. Tarin Forbes. And Mark, tell us a little bit about Dr. Forbes and what is our hack that we're going to be learning this week?
Well, I think we're going to learn it from Dr. Forbes. I know she's triple certified, which I think is a record for one of our providers here on Health Hacks. She's in St. Petersburg. She has a clinic called Masley Optimal Health Center. And I know that you help executives and top performers stay at the top of their game. You have some really cool health hacks. I know you do a lot with sexual wellness, peptides, breathing exercises, and something I'm interested in learning about, which is the new non-addictive, non-toxic Xanax, which pharmaceutical companies probably don't want anybody to know about, but our listeners are going to learn all about it from you. So welcome to the show.
Awesome.
I'm so happy you're here.
Thank you. It's an honor to be here. Super excited.
I guess the first thing is triple board certified. Tell me about your journey from traditional medicine into holistic medicine and helping people stay young and healthy.
Yes. So, Mark, I went into medicine, like most doctors, really wanting to help people. And, but I had really been more along the holistic route. My siblings were all chiropractors. My mom and my dad were into nutrition and fitness and supplements all growing up. I was an athlete, so I really wanted to rely on medicine and surgeries, as a last resort. And I was rather just disenchanted when I went to medical school, and I knew more basically about that kind of stuff, that area of medicine, than what medical school taught me. And then going into residency, not much better. We in med school we got maybe a week of very surface type nutrition. So anyhow, I then went into so as family medicine residency, and then after residency I joined a practice whereby I was seeing 30 patients a day, going to 6 hospitals, rounding in the ICU, on call every third night, every third weekend. I was just killing myself seeing these patients and trying to push everything I knew about nutrition, fitness, wellness into like a 10-15 minute visit. And it wasn't until I actually was 8 months pregnant and I lost my baby suddenly, unexpectedly.
Oh my God.
Yeah, it was a horrible experience at the time. And
devastating.
yes, but it was a really, really life awakening moment because obviously it was rather traumatic, but it woke me up to the idea that life is too short to not practice what we're passionate about. So, up until that point, I was so spread thin and so busy. And I didn't even know where to look for in terms of like health and wellness to
Mhm.
learn more about it. I've been robbed in my formal education. And so um by the grace of God, I stumbled across A4M, which is the anti-aging
Mhm.
and regenerative restorative medicine. They're world renowned, and so I signed up for their fellowship. I stopped rounding in the hospital, stopped taking call. I took 1 to 2 days off a week to just learn about the area of medicine that I'm passionate about. And so since then, I got board certified in that and
Mhm.
integrative medicine. And really reignited my passion in medicine. So um, I think it's something that I love doing. I'm actually taking people off medications. We're reversing disease, but not only that, we're teaching people to live optimally well, and using some really cool tools that we'll be
Mhm.
talking about to get them off of medications and just live the optimal, vibrant life that they dream of.
Do you think traditional medicine is all about troubleshooting and figuring out ways how to keep people on medicine just to mask the symptoms? Is that
Yeah.
uh,
It's unfortunate. In med school, that's what they teach us to diagnose and prescribe, not to take steps back and figure out, well, how did they get there in the first place, which really is the functional medicine approach to solving the problem and reversing disease. So yes, we're over prescribing drugs to cover up, put a band-aid on their symptoms, but not treat the underlying disease. And then their medications are not without side effects and long-term side effects. Acid blockers, for instance, it's largely overprescribed. I mean, you go to the hospital and you're prescribed acid blockers, and then you're discharged with them when you didn't even have heartburn to begin with. So it's just ludicrous. But we're seeing the long term side effects, like acid blockers actually inhibit your ability to make nitric oxide, which is
d-
so vital and important. We with Gainswave, we're all about opening those vessels up. Nitric oxide helps open those vessels, and if you're on a medication that actually blocks your ability to make that, it's crazy. So
let me ask you, like that, you bring up an interesting point. Do you think there's a correlation then between people that are on acid blockers and what Nexium, Tums, whatever, and ED? Do you think that that's there?
absolutely. Absolutely. Dr. Nathan Bryan, who is the leading expert in nitric oxide, he talks about that very thing, is that we need actually acid in our stomach in
Mhm.
order for our bacteria in our guts to make nitric oxide.
No, it definitely sends signals to your brain that when you have acid there and it causes your body to do things. And it's
Hmm.
interesting, like this whole concept of let's keep people healthy so they don't get sick. Now, when you went into
Yes.
integrative health and you went into integrative medicine, what's the biggest difference between that and, say, traditional medicine?
Well, integrative medicine is really using a multi-modality approach to fix disease. So it's looking at nutrition, it's looking at fitness, it's looking at stress management, sleep, supplementation, reduction of toxic load, hormonal balances. So it's looking at it's taking a multi-pronged approach versus traditional medicine is diagnose and prescribe.
Mhm.
And it's a cookie cutter, one size fits all approach to medicine, which really doesn't work. I mean, we're all so uniquely different.
And when you say that you're an athlete, what kind of sports did you used to do?
Synchronized swimming.
Wow,
Which
synchronized
unless
swimming.
you tried it, you'd be like, "Ah, that's not really a sport." But even my husband actually, he's a triathlete, and he's like, "I don't know how you do that stuff." So, I don't do it anymore other than play around in the pool with my kids. But yeah, I did it for 16 years. I was competitive synchronized swimmer.
It's like my youngest daughter is a competitive rhythmic gymnast,
Gymnast,
but a
okay.
rhythmic gymnast, which is very different
Yes.
from a regular gymnast. She dances with hula hoops
Oh,
and
yes.
dances with clubs, and it's interesting. I think,
That's awesome.
as we get older, doctors don't really stress the importance of fitness and exercise, when you meet a new patient, what do you guys talk about? Like, you get a guy who's stressed out and not exercising. He's, say, 50 years old. He says, look, I don't have time to exercise. What do you recommend for him?
That's a great question. I'm all about efficiency. I mean, I have 3 kids under the age of 6,
That'll keep you busy.
and yes, and a doctor, part owner, businesswoman. So I'm all about efficiency. And really, the studies have shown that you don't need a lot of time. Even a 4-minute interval where you do 20 seconds on high intensity, 10 seconds rest, 20 seconds on for 4 minutes
That's
can
it.
actually improve BDNF.
Did you hear that,
Now,
Rusty? 4 minutes.
4 minutes.
I'm
You really
in.
have no excuse. No one has any excuse. Now, obviously, you want to be active and like you want to mix it up and do a little longer exercises too. You don't want to just do high intensity intervals. You want to do some weight resistance. You want to do a little longer aerobic activity. But really, I mean, we all have. If the only thing you did was 4 minutes, you would still see benefits.
It's amazing how many
Um,
people don't even focus on just that. Walking,
I
everything's.
know.
Of that
Everything. Well,
4 minutes, what would you suggest to do a 4-minute exercise?
even jumping jacks for 4 minutes, all out, 20 seconds, all out, 10 seconds rest, 20 seconds all out, 10 seconds rest, 20 seconds in. I mean, that you can do if you can start with that. I mean, I don't know your baseline, Rusty, but you could do that. Sprint on the bike. I have a stationary bike. A lot of my patients have the stationary bikes or the Peloton, but not all of us can afford that. Even a 7-minute workout on your app, a 7-minute workout app on your phone,
I have
which
that
is,
one.
yes, I'm a big fan of that because it's a whole body workout. In fact, that was one of the biggest things that got me back into shape after having my third child because I was limited on time.
All right,
But
let
it
me
was
see if I
something
can.
that I got.
Let me see if I can understand right. So it's an app. So on my app, I just got to push with my thumbs for 4 minutes.
7-minute. Oh.
Not that. No. Okay.
No, not so much. It's a full body workout. So you're doing like push-ups, you can do burpees. You don't have to you can modify that. There's jumping jacks, planks. There's just a variety of exercises and you do it all out for 30 seconds and then rest 10 seconds and then move on to the exercise. And you just do that. It becomes, make it a non-negotiable habit that you do every morning. You'll see benefits.
Here's another controversial question in the integrative wellness world.
Mm-hmm.
Keto, paleo, intermittent fasting, combo. You're meeting somebody for the first time. He's trying to get back into shape. What do you recommend?
Yes, great question. Well, I mean, so our clinic is set up where we spend a whole entire day with patients. So we're really, really getting to know them because I think not like there's not one diet that fits every single person. So I'm getting to know like their needs. With I'm personally a big fan of the ketogenic diet, but I also like to kind of switch between Mediterranean diet and ketogenic diet for me personally. And I see that work with a lot of my patients because it gives you that metabolic flexibility. So you think of your car using diesel and gasoline, regular gasoline. You want it to be able to use both fuels. So, but for me personally, ketogenic diet turned on my brain. And,
so no
that's
rice,
incredibly important.
No rice, no cheat days, no bread.
Well,
no sugar.
so you can have a cheat day now and then, and that's that metabolic flexibility that I talked about. But you want to try and make a little bit more educated, decisions on what you're going to choose on your cheat days. Like those starchy carbs, like you're going to have more, say like sweet potatoes or some of the starchier vegetables, because I do definitely think they have some nutritional value. But yeah, you're not gonna reach for that, like the pizzas and fries and chips and stuff now and then. Yeah. But, not on a regular basis. Let's put it that way.
Intermittent fasting, you see that working really well?
Love intermittent fasting. I use that tool all the time. I personally use it. It upregulates pathways, anti-aging pathways. It upregulates autophagy, which is needed for cellular renewal. It actually has an impact on our gut bacteria. So intermittent fasting, I'm a huge fan of. It puts a little bit of stress on our bodies, which a little bit of stress is good. And it allows us it activates your stem cells, which is the fountain of youth. So, big
I
fan of it. For me, I see it shift the needle with a lot of patients who have been struggling.
Mhm.
Just with, it's hard for them to try and decide what to eat, especially for breakfast. And it helps reset that insulin sensitivity. So I love it. Most of our breakfasts consist of carbs, to be
Yeah.
honest, like in the standard American diet. So it kind of takes that out of the equation, which puts less stress on the body.
Talking about stress, which is probably, I think, everybody's biggest issue, and it seems like as we get older, maybe it's
Yeah.
we're in a connected world. How do you eliminate stress? And I want to dive into what we want to talk about is that natural Xanax that you're
Yeah.
saying, this new thing. Tell our viewers all
Yes.
about that.
Yeah. So stress, I believe, is truly the silent killer. It's, you know, it's our Achilles heel. And especially in this day and age, where we are just a very fast paced society, um, constantly surrounded and bombarded by electronics, and just the demands have increased and so forth. Stress is a huge issue, and I deal with a ton of executives, and so it's a very common thing, and anxiety as well. And so I have a lot of patients that come to me that have been on Xanax for years, that have been on Ambien, and
Mhm.
have difficulty sleeping. And of course, you need sleep for repair, and sleep to allow that pulsatile increase of your growth hormone at night, which you need for cellular renewal and repair. So it's an important thing. And the medications, unfortunately, like Ambien, for instance,
The worst.
the worst. And Xanax. I mean, Xanax been shown to actually shrink your hippocampus, and has been associated with dementia and Alzheimer's.
Mhm.
So, and it's not to mention it's addictive and so forth, and obviously there's toxicities to it. So I just came back from the International Peptide Society not too long ago, and their conference, and we got talking about this compound called dihydrohinochiol, and
Dihydro
dihydrohinochiol.
Pinocchio.
So hinochiol's been around for a while. It comes from magnolia, which magnolia, from an integrative medicine perspective, is very, very helpful for stress. It's kind of an adrenal adaptogen, helps balance out the adrenal glands, and recall adrenal glands secrete cortisol, which cortisol, is
Mhm.
upregulated in stress and leads to aging and so forth. So the magnolia helps regulate that, and relora, some people know relora, that can help with stress and sleep. So this formulation that is actually made by Tailor Made Pharmacy, which is a compounding pharmacy,
Uh-huh.
um, it's incredibly effective. So we've since put all of our patients that, well, not all of ours, but a lot of our patients who were on Xanax and Ambien, we've since kind of converted them to it. The office has tried it. I've tried it. It just really mellows you out. It lasts about 3 to 4 hours.
Is it
Onset of
is it
action is 20 minutes.
is it a pill, an
It's a
injection?
capsule, tiny, tiny capsule. Tiny capsule, no toxicity. What's really, really cool about it too is that it upregulates SIRT3, which is an anti-aging pathway, an anti-inflammatory pathway. It upregulates GABA, which GABA is
Mhm.
your natural Xanax and neurotransmitter. So, and then also it works on NF kappa B. So it has anti-inflammatory impacts. It also, there's some evidence to show that it works on cancer stem cells. So we're thinking that's beneficial for cancer stem cells. And recall, I'm part of this adaptive cancer care essentials program led by Dr. Mark Rosenberg, who's just a
Mhm.
genius and brilliant cancer scientist. But what he taught me years ago was that chemo, for instance, does not actually act on cancer stem cells.
Oh,
This actually works on cancer stem cells, which is really cool. So cancer stem cells is like the mother of the cancer. So you really want to attack that. So I
yeah.
just think it's a awesome nutraceutical that I can't wait to use more and more.
Is there a blood test that you do to see what peptide somebody should be on? Like, how do you know what to prescribe?
Yeah, no, that's a great question. I think it's really their clinical picture. So if we have someone who is has got a lot of inflammation in their body and like autoimmune type disease, then we can use peptides such as thymosin alpha 1. And thymosin alpha 1, actually what happens is like these cells that become mutated can um can can go missed by our natural like checkpoint inhibitors. So we have
Uh-huh.
like in this cell cycle, we have checkpoints that kind of you know help us pick up when there's DNA mutations or protein malformation and so forth, and it allows us to correct in our cells. Um, so cell senescence is when these cells have actually broken free and broken loose of that cellular correction that's built in our system by our immune system. So like these senescent cells can kind of camouflage themselves so that our immune system doesn't recognize them.
And
Does
what's
that
the
make
problem with
sense?
yeah, but what's like if somebody has senescent cells, what does that
Yes.
lead to?
It can lead to cancer.
So
You know,
by looking at this early, we can prevent cancer from happening instead of treating cancer with chemo and everything else.
yeah,
Now,
potentially. You could there's tests that where you can check for circulating tumor cells and so forth. That's like early screening tests. Those are right now it's mostly used for checking for recurrence of
mhm.
disease. Um but yeah, if you can have these early markers and then and then pick up the fact that these patients are in kind of more of a senescent state, and what thymosin alpha, for instance, it takes off that camouflage from on the senescent cells so that our immune system recognizes
Mhm.
that these cells are faulty and can go after them, which is really cool.
Now, for the layperson, like, what are peptides? Because 5 years ago, 10 years ago, nobody was talking about peptides. That's now a big buzzword in the integrative wellness
Yeah.
community.
It's awesome. I honestly, peptides are, I think, one of the biggest tools currently, but then also in the future. I think it's just going to get better and better. It's just exploded. So peptides are essentially they're long chains of amino acids, and they're very similar to what we already have in our body and structure. So they're very clean. Safety profile is incredibly good with them. Um, so we have peptides for growth hormone releasing hormone, which looks very similar to what we already have in our body. It just stimulates the release of your own growth hormone.
Uh-huh.
Um, we have peptides, as you know, that work on the nervous system to improve, like with erectile dysfunction, PT141, and they also work for females for
T t
asexual dysfunction with
t t
them.
tell us about that one, the female asexual peptide. So this makes a woman want
Yes.
sex.
Want sex.
I
It
think our viewers need to hear about
increases.
that.
Yes. Yes. So sexual dysfunction in women is very, very common, actually. It's about 40% of all women, which that statistic to me, it seems like a lot, but when I think about it, a lot of a lot of female patients come to me and they're like, yeah, my libido is not the best. And I just don't have any desire. So that it works on their nervous system. So it actually increases their desire.
Is that also the
Increases in
PT-141 or is it a different
Yeah,
peptide?
it's the PT-141.
Got it.
So, and that's injectable. In my experience, so they say it can work in within 3 hours, and it usually does. But I've had a couple people, it takes a little longer. But usually, your first dose determines how long it's going to take you.
Okay. This is exciting. So, like, if somebody wanted to meet you, learn more about your programs, you're in St.
Mhm.
Petersburg, right? St.
I
Petersburg,
am.
Florida.
Yep.
Beautiful city, awesome city.
Yes. It's
How-
gorgeous.
what's the best way for somebody to get in touch with you?
So if they just go to our website, themohc.com, and Massley Optimal Health Center, then they can
TMOHC.com.
the MOHC, Massley Optimal Health Center.com.
Okay, we'll have it in our show description. You're a very exciting guest. I want to learn more about the sexual function for women and all the stuff you're doing, sexual wellness. Later we can have another talk about that because I think you're doing some
Awesome.
wonderful things up there.
Yeah, thank you. Oh, it's awesome. This journey has been just great, and it's definitely invigorated my love for medicine because we're getting people well and optimally well. So,
What's next on your journey? Where are you? What do you see in the future?
oh gosh, eventually I'd like to write a couple books. My partner, so Stephen Massley is my partner, and he's been a mentor throughout this whole journey, and I've known him for years. I actually rotated with him as a resident, and he's been kind of a pioneer in wellness, in this area. And he's written a bunch of books and does podcasts. He's actually traveling the Mediterranean, writing a Mediterranean cookbook. He's a trained chef as well. So
Wow.
I would like to follow in his footsteps one day too. But really inspire, I think definitely sexual health is one of my passions for sure, for men and women. So probably something along those lines and involving, stress management, breathing techniques, peptides, O shot, P shot, Gaines wave, Femi wave, all that good stuff.
Well, it's
Everything. Yeah.
awesome to have such a passionate provider just following her dreams. We're
Aw.
so happy to have you on the show. Thank you so much. It's Dr. Tarin Forbes with the Massley Optimal Health Center in St.
Awesome.
Petersburg, Florida. Thank you very much.
Thank you so much, guys. Thank you, Mark. Thank you, Rusty. Have a great day.
And if you want to find out more about Dr. Tarin Forbes, go to themohc.com. That's themohc.com. If you want to find out more about Mark L. White, go to marklwhite.com. And don't forget to subscribe to this podcast. It's very simple. Apple Podcasts, there's a little subscription button. YouTube, hit the little subscription button and tell people about health hacks with Mark L. White. Keep up to date on all the latest, greatest health techniques and health hacks. Thank you very much, and we'll see you next time here on Health Hacks with Mark L. White.